Well, unfortunately, I think it's not being handled very well and very energetically at all. I think the whole problem is being sidestepped, possibly because it's politically incorrect. I think the Department of Health, certainly since I started writing about this in February 2013, have had a fabulous opportunity to really delve into it and do proper targeted research, which they've failed to do. But if we define health tourism as a start, health tourism is defined as people who come to this country with a pre-existing illness, pre-existing illness. That's important to understand. And their motive is to target free NHS care. And it is very, very simple to do. You need to be only minimally motivated, and almost certainly you will succeed. And that is the sad thing, because we have an NHS which is free at the point of service. There's no checking whatsoever, or very little checking, about people coming for secondary care, meaning hospital care. And it's very easy to break through the rules. For example, one of the largest group of offenders are British people who have been living abroad for 5, 10, 15, 20 years. The longest person who has been on non-contributory absence that I know of is 48 years. They've got an NHS number from birth. They walked straight back into the system. No one can possibly identify them. And they just have whatever treatment they want. And it's ever so easy. Which contrasts with any other health system, comparable to ours, anywhere in the world, where there has to be some sort of identification, photo identity, that sort of thing, to access health care.
So, Meirion, what do you want done about it?
I think it would be very easy to do. There are several things you could do. Obviously, this government has rejected the possibility of having identity cards. So we've got to do something that's simpler than identity cards. So what I've suggested to the Department of Health is that when a patient is referred to hospital, obviously they have a reply letter from the hospital giving the time, date and place of the appointment. That letter could be accompanied by a simple single sheet of paper on one side listing the criteria for eligibility for free NHS care, on the back listing the criteria which make people ineligible for NHS care. That would be a simple thing to do. And then when the patients arrive in hospital, they actually have to register. At the time of registration, they have to produce some photo ID, either a passport or a driving license with a recent utility bill on their name. Just as you would have to do, for example, if you were trying to access any financial service, just as if you were trying to open a bank account, or even if you were trying to arrange residence parking, or even, because of my great age, if you're trying to get a free pass for the tube and the buses, you have to produce some photo ID and a recent utility bill. Why not make that an absolute requirement for access to secondary care in the health service? It would be so easy. It's just a matter of people getting used to it.
So reforms are very important, as you've just been talking about. What are the most recent important reforms that...
Well, as you know, Simon Stevens has published his 5-point plan. I think the most important of those plans is the amalgamation of hospital services and the GP services. What we have at present is two monolithic structures, hospitals and GPs, and there's virtually no crossover, no communication between both. I have to say I'm very concerned about general practice in this country. Medicine has moved forward with enormous technology, all of which is concentrated in hospitals. Very little has filtered down into GP practice. Most GP practices have not moved much further forward than Dr. Finlay, and they have no access to modern methods of monitoring things like asthma, diabetes, etc. And I've got this little novel idea. In hospital practice, the best thing that's happened in the last 10 years is the appointment of clinical nurse specialists who are senior nurses. They are disease specifically trained. So for example, if you had, let's take diabetes as an example. Let's take asthma as an example. It's a better example. Something like 5.4 million people suffer from asthma. Something like 1,200 people die from asthma every year, and the total bill for asthma medication is about £1.2 billion. So if we had clinical nurse specialists who were attached to hospital chest units, their sole skill was asthma, for example, then they could do clinics in general practice and look after the patients there. When the patients required lung function tests or whatever, they could quickly go back into the hospital to have it done. So remove general practitioners from the care of chronic illnesses, which amounts to about 2/3 of all the work in general practice, and bring in highly skilled nurses. Something that GPs will really, really object to, but it's an obvious move forward, I think.
And the other worrying topic is all these foreign doctors coming into the UK whose education might not be on a par with British doctors.
Well, this has been going on for forever, 30 to 40 years. We have been importing about 30 to 40% of our doctors year on year, and it doesn't seem to bother anybody at all. GMC seems to register these doctors fairly easily. There's some doctors who've created mayhem, and they've made headlines, for example. The patients coming from, most of the imported doctors now come from the EU, from areas where there's been austerity difficulties in Portugal, Spain, Eastern Europe. All those doctors have an immediate right to register with the GMC because primary medical qualifications, as a result of European Union rules, are accepted across all European borders. So, for example, I've been told that lots of doctors from Romania now don't even bother to register in Romania, they just register here. Same from Greece.
And a message to the GMC to sort this?
Well, it's not for me to tell the GMC anything, except I would like them to concentrate on it a little bit. I think some very interesting research that was published in the BMJ last year, perhaps it was this year, earlier this year, that when foreign graduates take specialist examinations in this country, only about 20% of them will achieve the median standard of UK graduates in that postgraduate exam. That means that they're not so good. But once they get through the exam, then they've got access to consultant posts and specialist training and all the rest of it. And to me, that is a great big worry. But sadly, it doesn't seem to worry anybody else, and certainly not the GMC or the Department of Health.